What if I told you that your eyes could hold a critical secret about the health of your brain? That a sudden change in your vision might not be an eye problem at all, but actually a ticking clock, a warning for a major health crisis. Well, we're going to dive into exactly that connection. You heard that right. We're exploring a link that could genuinely save a life. We're going to look at a very specific kind of eye emergency and unpack how it can be a hidden but crucial warning sign for a stroke. And this isn't just a guess. It's a connection that's now backed by a huge scientific review. But before we get into the nitty-gritty, let's just set the stage. 4.5 hours. That number is everything. It's the critical window doctors have to give clot-busting drugs for most strokes. Once that window slams shut, the chances of a good recovery plummet. It is a terrifying race against the clock. All right, so what is this critical warning sign? Well, it's a condition that the medical community has given a pretty powerful nickname: the stroke of the eye. The official medical term is retinal artery occlusion, or RAO for short. Now think of it like this. A clot suddenly blocks off an artery, cutting off the blood supply. Only instead of the brain, it's happening in the retina, at the back of your eye. The result? Sudden, and here's the key part, painless vision loss. And because it happens the exact same way as a stroke in the brain, it's very fittingly called a retinal stroke. And this is the absolute crucial connection. It doesn't matter if it's in the brain or in the eye, the root cause is identical. A blocked artery starves precious tissue of oxygen. The only real difference is the zip code. It's the exact same disease process, just showing up in a different part of the body. So you're probably thinking, okay, that makes sense, but how strong is the link really? Well, to find out, we're looking at some serious evidence from a huge meta-analysis. They pooled the data from 12 different studies, looking at a massive group of over 300,000 people. And the results, they are pretty stunning. The data showed that having one of these eye strokes dramatically increases your risk of having a future brain stroke. Get this number, 3.64 times more likely. Someone who has an RAO is over 3.5 times more likely to then have a stroke compared to someone who hasn't. That is a massive red flag. And here's what that looks like with real numbers. It's not just abstract risk. Out of all the patients who had an RAO, almost 13% of them went on to have a stroke. Now look at the control group, less than 3%. The difference is it's stark. It's not even close. Now, a good question is, what about heart attacks? The researchers looked at that too, and they did find a bit of an upward trend, about 1.38 times the risk. But, and this is important, it wasn't what they call statistically significant. The link just wasn't strong enough to be a sure thing. So while it's always smart to check the heart, the really powerful, undeniable connection here is between the stroke of the eye and a stroke in the brain. Okay, so we know the risk is higher. That's clear. But the next, and maybe most vital question, is when? Is this a risk for the rest of your life? Well, it turns out the danger is not spread out evenly at all. There is a very, very critical window. The analysis found that the risk is incredibly front-loaded. I mean, look at this. In the first 30 days after the eye event, the rate of stroke was over 3.5%. But then, after that first month, the risk just plummets, way down to less than 0.5%. The message couldn't be clearer. The danger is immediate. And hey, you don't have to take my word for it. The study's authors said it perfectly themselves. They wrote, "The risk of stroke was highest within 30 days of RAO, underscoring the need for prompt cerebrovascular evaluation." That isn't just an interesting finding. That's a direct call to action. It's a flashing neon sign for doctors everywhere. So, this all leads us to the most important part, right? What do we do with this information? How do we turn this incredible insight into something practical, something that can actually save a life? Here's the key takeaway. It requires a complete mental shift. An RAO is not just an eye problem. It's a systemic event. It's a warning shot fired by your body telling you that the conditions are ripe for a stroke. And this new understanding is precisely why huge organizations like the American Heart Association and the American Stroke Association have actually updated their official guidelines. So here it is, the action plan. It's dead simple. Step 1, treat any sudden, painless vision loss with the exact same urgency you treat chest pain or weakness down one side of your body. It is a medical emergency, period. Step 2, do not wait. Don't call to make an appointment with your eye doctor. Go immediately to the nearest stroke center or emergency room. And finally, step 3,
You have to be your own advocate. Tell them what happened and insist on getting checked out for your stroke risk right away.
So we end right where we started, with that question. Is your eye a window to your brain's health? Well, after looking at all this evidence, it's pretty hard to say no. A sudden blockage in your eye is one of the most powerful predictors of a future blockage in your brain. Knowing this doesn't just make us smarter, it gives us the power to act faster. And that can change everything.